So good afternoon. I'm Dr. Rob Silver, and I'm a holistic veterinarian, and I'm going to present today on a study that I was part of, measuring the ability of pet CBD to improve the behavior in dogs. It's a 20-question survey, but I'm not going to just present the talk. I'm also planning on discussing how it is that CBD does calm the animal, how it does affect behavior. So first, so to give you a summary of what I'm going to talk about, we're going to be first talking about how CBD and terpenes and nutraceuticals can affect behavior. And then I'm going to be presenting two studies. One study where they compared the effects of CBD to trazodone in reducing fear-based behavior to loud noises that didn't show any benefit to the use of CBD. And the other is this survey study that I was involved in 98 dogs in 5 different metro centers. And we'll present the results from that study, which was pretty successful. And then I want to talk a little bit about how we can use CBD to help us with behavioral modification, because there is no magic pill for behavioral modification. And then I'm going to kind of go off topic a little bit and share with you what I've learned from the studies and what I've learned from clinical practice as far as what's the best way to administer the CBD to your pet, and what are the best ways to figure out an appropriate dosage for your pet's problem, your pet's size. A little bit about me. I'm a holistic veterinarian. I've been practicing in Colorado since I graduated from Colorado State University in 1982. I'm an expert in the use of herbs for veterinary purposes. And I've had hands-on clinical experience as a practicing veterinarian in Colorado ever since the legalization of medical marijuana in Colorado, when clients would start coming into my office having given their pets some CBD or cannabis for their problems and having had good success. That's what got my interest. That's what piqued my interest as a veterinary herbalist in the medical benefits of cannabis. I've got several books that I've authored. I've got Medical Marijuana for Your Pet that I'll be showing that to you. I'm in the middle of creating a new book on pet CBD that should be out in the next 3 months. And I provide educational seminars just like this nationally and globally to companies, to pet owners, to veterinarians about the benefits of nutraceuticals, which are dietary supplements for pets, and about the benefits of cannabis for our pets. I've also formulated a number of products for a number of different companies, and I've founded a blog site. I've got an e-commerce site, and I'm developing a telehealth site to help people figure out how to give their animals cannabis in a safe fashion for their conditions. Here's the book I wrote 5 years ago, Medical Marijuana and Your Pet. It's still a good book, but my new book is bringing everything up to date with everything we've learned over the last 5 years from research and from clinical experience. I've got several published articles. This is a peer-reviewed article in a journal called Animals, in which I discuss the endocannabinoid system of animals, which is the target of pet CBD, which is the target of pet cannabis. I'm also an author and a co-author on 3 chapters on this soon-to-be-published veterinary textbook by Springer Nature. One of the editors of the textbook is actually here in our office, Dr. Jamie Gaynor. I've contributed chapters on the endocannabinoid system, on hemp nutrition, which is one of my specialty areas, and product selection and dosing considerations. And I'm going to be sharing some information from that 3rd chapter with you at the end of today's talk. This is a screenshot from my blog, nurseyourpet.com. I co-blog with two other veterinarians. One is an equine holistic veterinarian with an expertise in CBD, and the other is a board-certified canine rehab specialist. So it's a very interesting blog site, not commercial at all, a lot of good, useful information for the pet owner for you. I have my own e-commerce site as well, Well Pet Dispensary, and I encourage you to take a peek at that and see what you think. So let's get started with the actual content. Enough about me. So what are phytochemicals? Are molecules that are derived from plants, okay? And what phytochemicals in cannabis, what are the phytochemicals that affect behavior, and how do they do that? Well, first, let's start with a couple of basic definitions that you may already know of, but I want to start with kind of a common denominator here. Full spectrum hemp is the complete plant extract, including the THC, and hemp, as you know, contains less than 0.3% THC on a dry matter basis. Broad spectrum hemp is the same as the full spectrum, only the THC has been either removed or significantly reduced. And then we have what's called CBD Isolate, which is the purified extract of just CBD alone. It's usually like 99.7% pure. And then within the cannabinoids, within the cannabis, we have a variety of cannabinoids. I'm sure you know about CBD, but do you know about CBG? Or do you know about CBN? Or do you know about CBC? All of them, in addition to CBD, will have an effect on calming behavior. So so when you're looking at a full spectrum or a broad spectrum extract, it has a lot more than just the CBD itself to produce a calming effect. There also are terpenes in cannabis, and terpenes are these small little molecules that give foods, fruits, and vegetables their aroma and their taste. If you've ever squeezed a lemon and you've smelled that, then you know what the terpene limonene smells like. And if you've ever smelled lavender, then you know what linalool smells like. And so in cannabis, we have linalool and limonene, and we have myrcene. Myrcene, if you like an IPA, you know what myrcene's all about. It's found predominantly in hops and used to be found just in medical cannabis. But now with the use with the breeding of the THC in medical cannabis down to hemp levels, we are getting to see a lot more myrcene in our hemp cultivars as well. This is just a page from a journal article that shows you, let me see if I can use this. Oh, no, wrong one, sorry. That shows you the limonene molecule, the lemon, and the pinene. If you've ever been in a pine forest and felt kind of a mental clarity, that's the effect of pinene. Myrcene with hops, linalool with lavender, and although this is not calming, beta-caryophyllene is a very important terpene found in hemp, and it does help to reduce inflammation and have an impact on pain. Talking about each of them individually, linalool, primarily found in lavender. It's a great anti-anxiety. It also has pain-relieving properties. It has anti-convulsant properties and is considered to be both sedating and calming. Also, interestingly enough, has been found to have some anti-cancer properties as well. Limonene, found in citrus primarily, has antidepressant properties and anti-anxiety properties, and has a host of other properties as well that don't really speak to behavior, but limonene also can promote alertness. And in fact, one of the properties of CBD that we like is that it also promotes alertness. CBD is not itself sedating. It's usually the terpenes or possibly the THC in the hemp compound that has the sedating properties. We have myrcene found in hops, sweet basil, mango, and you know, there's this urban myth that if you eat mango and then you smoke some reefer, you're going to get a lot higher because you're getting additional myrcene. And it's thought that the myrcene works synergistically with the THC to increase the psychoactivity of it, the intoxicating nature of it. But anyway, myrcene is sedating and calming, and also has anti-anxiety properties as well. CBD actually works with several receptors in the body, receptors that are responsible for producing serotonin. We know about serotonin as being the calming neurotransmitter. CBD also affects the GABA receptors in terms of increasing the amount of gamma-aminobutyric acid, which also has some calming and sedating properties. And in fact, CBD also will stimulate an increase in the body's anandamide, which is the body's own endogenous cannabinoid. And anandamide itself can be very calming. It's what we believe is responsible for the runner's high. So it's that feel good that you get from that physical exertion. We also know that, people joke about potheads, they have short-term memory, they can't remember things, but that actually is a very important function of cannabis, that it allows us to forget, because there's some memories you don't want to hold on to. There's some memories that if you keep them in your mind, they manifest in your body as disease. That's the old PTSD thing, the trauma of warfare, trauma of trauma, just never goes away till you forget about it. So smoke and dope can help that. CBD can help that too. You don't have to get intoxicated to forget. And this forgetfulness, forgetfulness is what they call called neurogenesis or plasticity, which means that the synapses change so you can make new memories instead of keeping the old memories. And like I mentioned, CBD is being used to treat PTSD and obsessive compulsive disorder and phobias as well. So this is a little bit complicated, but this basically shows that CBD has an effect on multiple membrane receptors. The membrane receptors that we're most interested in here in terms of the calming is its effect on the CB2 receptor, and CB1 receptor in terms of enhancing the amount of blood levels of anandamide, and also on the 5-HT1A receptor, which is responsible for producing the serotonin in the body. Okay, let's talk about a couple of anxiety studies in dogs. So this study came out of the University of Kentucky, and they wanted to see if CBD had comparable anti-anxiety properties to a psychiatric drug called trazodone. And trazodone really needs to be given on a daily basis for several weeks before it really kicks in, but early on it can also just create sedation. CBD really needs to be given for more than just a single administration in order for it to really have any kind of substantial effect on calming behavior. So, but in this study, what they did was they subjected these dogs to a loudspeaker with sounds of fireworks that generated fear in them. And they were able to measure the fear by various body positions, body language, and they were able to take measurements that way. And they tried to see what would happen with CBD alone, trazodone alone, and CBD plus trazodone. But personally, I think that this study was very poorly designed because they didn't give the noise challenge for 4 to 6 hours after the CBD was given, at which point, because we know CBD has a peak effect at about 1 to 2 hours. So at that point, the CBD was declining, and they did it after there was just a few hours on the trazodone. It was 2 to 4 hours before the test. And what they were doing, in addition to measuring body language, was measuring cortisol. Cortisol is the stress hormone. And when you are stressed, you produce cortisol. So they used that as an objective measurement to see if they could get some significance between these two groups. Well, the CBD had no effect. The CBD and trazodone had no effect, but the trazodone did have an effect. I just don't think this was a great study. In fact, usually with CBD, we see a reduced heart rate, and for some reason in these dogs, we saw a higher heart rate. And there just were a number of things here that were just too questionable. I'm not sure that the dose may have been too high. We find that with anxiety, that generally you actually need a lower dose than if you're treating for pain. So it may be they were using too high a dose. Their dose was about 1 mg per kg per pound, and really the anti-anxiety dose is more like 1/4 to 1/2 mg per kg per pound. So it's significantly less. So I was involved in a study with this company, Ocoa Pet. They did a survey. They enlisted a canine service company that is online, that's in 5 different metro centers, and they have a database of like 25,000 pet owners, and from that they were able to recruit 98 dogs for this study. And the chews that we used, that I designed, contain tryptophan, and tryptophan's a precursor for serotonin. It has choline chloride and phosphatidylcholine, which both have an influence on calming neurotransmitters. Think Colidin, Jamie. Think Colidin with this, Colidin plus CBD. And then I used German chamomile, which has some very good calming properties as well. And I know that you probably can't see these questions, but these were the questions that we asked, and these were the responses. And the red line is the pre-treatment response, and the green line is the post-treatment response. So you can see that for in almost every case, the amount of stress which is denoted by the taller red line was much higher than the stress afterwards. What we did was we had the pet owners first answer these 20 questions, and then we gave them these soft chews to be given according to their animal's body weight daily, twice daily, for 30 days, and then we had them fill out the survey a second time. And these were the results we got. Some of the questions were, my dog is anxious during a thunderstorm. My dog is upset by loud noises. My dog barks intensely when someone comes to the door or rings the doorbell. My dog is nervous when I get ready to leave the house, talking about separation anxiety. My dog is destructive when left alone, separation anxiety. My dog panics when riding in a car. It's car phobias. And oftentimes they panic when they're put in the car because the only time they get to go in the car is to go to the vet or the groomers, you know. My dog is nervous when visiting the vet or getting groomed. My dog does not sleep well. My dog is hyperactive. And then these 3 questions were the ones that we didn't get the most statistical significance because they're more quality than quantity. You know, my dog is happy. I mean, how do you quantify happiness? My dog is mostly calm. My dog is playful. But then we have, my dog always seems hungry. My dog is a picky eater. My dog is anxious. My dog frequently scratches his or her skin. My dog is afraid when meeting other dogs. So I think these questions are really representative of the kinds of questions that a person who has a pet who is very anxious would say, yeah, that sounds like my dog. So I think this was a very good study. I think these were very good questions. We had a pretty good distribution in terms of the sizes of the dogs that we saw and the ages of the dogs as well. So it was in 5 different metro centers. So it's not like it was specific to any one area. It was Seattle, Minneapolis, St. Paul, Denver, Chicago, and San Francisco. So it was pretty cool. And we're in the process of doing a second study now. We're doing this in collaboration with Dr. Kogan at CSU. And I was hoping to enlist some participants in the study from our audience today, but I don't think that's going to be very fruitful. But anyway, let's go on to the next slide. So we have these ingredients that I had mentioned, the broad-spectrum CBD, tryptophan, precursor to serotonin, phosphatidylcholine from non-GMO sunflower lecithin, choline chloride, which is a precursor for transmitters and also is structural support for membrane fluidity of neurons and immunocytes, And then German chamomile, which actually binds to benzodiazepam receptors. Benzodiazepam, think Valium, okay? And they've also found a gamma aminobutyric acid, GABA, actually in German chamomile. So it has a lot of value, I think, as a calming agent. But the study's good, and I think we can use CBD to help us with behavioral modification. But we also need to remember that that's not a magic pill. Training is the single most important thing you can do. If, when your puppy's young and you just adopt it, or when you adopt a new pet, that's the best time of all to start the training. Training actually establishes a language of communication between yourself and your animal. Dogs want to know how to please you. They just don't know the language. You need to teach them how they can please you by sitting quietly, how they can please you by not getting on the bed, or whatever it might be. But you need to give them that language. And the best language to use is rewarding them for good behavior, but ignoring their bad behavior. If you make a big deal about their bad behavior, well, any attention's good. So they may want to continue with their bad behavior just to get bad attention, whatever, at least they're getting attention. So that's the difference between positive reinforcement versus negative reinforcement. So, this is my little, when I speak, I try to talk holistically about the whole picture. It's not just about using a drug or a supplement. It's about the whole lifestyle, because that's really where you get the most amount of success. And I believe that using supplements or using drugs allow the animal to slow down enough to listen to your commands. It's really the commands that are the important part, not the magic pill. All right. And then I want to talk a little bit about some tricks and tips from studies and from clinical practice as far as optimal administration and dosing. So a lot of the published studies that we see for arthritis in the dog are using pretty high dosages. They're using dosages of about 2 milligrams per kilogram, which is about 1 milligram per pound twice daily, approximately. And in my own work, I have found that many dogs respond well, even with painful conditions, to a lower dose to begin with. And so I feel it's a good strategy to consider starting with a lower dose and gradually working your way up to find the sweet spot that works best for that pet. Now, it's interesting that we have Dr. Gaynor here in the audience here, if I may pick on you a little bit. Dr. Gaynor is a pain specialist for pets. And in his approach, for an animal who's painful, he prefers to start with a higher dose to get immediate relief, and then he'll lower the dose gradually over time. And I think that's just as legitimate an approach. Higher doses can be associated with increased incidences of some side effects like diarrhea, but not really that big a deal. And so I think it really depends on your vet's advice and what you feel is most important. I think that, CBD is not an emergency treatment. To really get good results, you're probably going to have to wait 7 to 14 days to get a good steady state going. So I think it's kind of 6 of one and half a dozen the other. We have a lot of drugs right now that are very, very, very potent and safe to use that could also establish pain relief to begin with, that we could then start with a lower dose. So, they always say there's lots of ways to get to Denver, and there's a couple of choices for you as far as how to dose. The biggest problem with a low dose is that it is ineffective. So I still believe it's good to start low. Even with any supplement at all, I always recommend starting low, because if your pet, for some reason, has an unusual reaction and develops diarrhea to that supplement, you're going to be very reluctant to give it to it a second time. So that's why I feel it's better to start low, avoid the side effects, and then you're going to be much more willing to continue, because it's not a single administration that makes a difference. It's the continued ongoing administration day in, day out for weeks that ultimately is going to make a difference in terms of helping your dog feel less pain or have better behavior. So, and there's different factors that affect dosing. It's not just a matter of body weight. You know, we want to look at, are they overweight or obese? What about the severity of their disease? Severe diseases need higher dosages of CBD. Pain, epilepsy, cancer, dermatitis. Mild diseases, maybe not so much. Mild pain might be fine with a lower dosage. Anxiety, certainly, probably better with a lower dose. And wellness dosing would also be relatively low. That's kind of a controversial question. Can we really do preventative? Can we really create wellness with daily CBD? And I think that's open for debate, and it's a conversation that we're not going to have here, but I think that there are reasons using it on a daily basis can help if there are issues with the endocannabinoid system that could be genetic in origin or could be secondary to the disease. And then, is there THC in the formula? You know, THC is the limiting component of a product you're going to be giving to a pet, because dogs are excessively sensitive to the adverse effects of THC. It's not toxic, but they don't need much of a dosage in order to develop a reaction. So the secret to dosing dogs for THC is to start them with a tiny dose and give that tiny dose for a period of a week or two in order for them to establish tolerance, and then you can start to increase the dosage. THC is very helpful at higher doses for pain when used in combination with CBD. But for veterinarians, THC is a Schedule I drug, and we're not allowed to recommend its use. But pet owners are going to be able to get THC on any corner dispensary and give it to their dog and send them straight to the ER. And that's why I think it's important to work with your veterinarian to learn safe approaches to helping your pet with cannabis. And then, how do you give it? We're hearing all these things about absorption, water soluble, this and that, nanos, and whatever. And so what they have found is that with the basic tincture, with the basic oil tincture, that if you give the basic oil tincture and follow that with a meal, you're going to get an improvement in absorption 4 to 10 times. This is the same improvement in absorption that these liposomal companies are touting, and they're charging you more for it. So I don't really think there's any need to go with these fancy preparations. I think you just need to be aware of what the studies say. And we have studies now in dogs, in humans, in rats and horses that show that administration with some food, especially some fatty food, can increase the blood levels. Soft chews have their food included. So they themselves, as the result of 2 studies, are every bit as well absorbed as oil that's been given with food. So that's another advantage in addition to the treat-like nature of soft chews. Okay, and then what is the right dosage after all? We talk about all these different considerations, and there's something called the U-shaped curve, or the biphasic dosing in cannabis. And what this means is that a low dose might work, and a low dose may not work, and a high dose may not work, but there is a dose in between that may. So if you look at these bar graphs here, this is having to do with anxiety in people. And here you see the red line is the placebo. So you can see that's the top end of anxiety in this particular test. This is clonazepam, which is a lot like trazodone as far as a sedative. Clonazepam is used as an anti-epileptic in humans. And you can see the amount of stress there pretty significantly lower. But here with CBD, 100 milligrams, almost the same as placebo. 900 milligrams, almost the same as placebo. But look at that, 300 milligrams, and you get a response that's almost equivalent to the clonazepam. So what I'm saying is that, you know, this is kind of the American way, bigger's better. But when it comes to dosing cannabis, that may not necessarily be the truth. The right dose is the right dose. And that's also why I think starting low and working your way up may be the best way to find where that window exists that would give the best dose for your critter. Takes a little more time, but I think once you get that good dose, you could be saving yourself a lot of money and a lot of CBD oil if that's the case. Now, getting back to the starting high or starting low thing, which is, this is an important point, is that if the product contains THC, then starting high has the risks of supplying more THC than that individual would want to have as far as the first time it's ever exposed to that. So that's where using a broad spectrum might be worthwhile, starting higher, because you're not going to have potential problems with the THC. And then, and then once you get to a higher level, you could then go to and then if sorry, and so yeah, so with the THC in it, I would recommend titrating up, versus if it's broad spectrum, I would recommend titrating down. But it's up to you as far as what you do. There's lots of different ways to get our animals to respond well. Alrighty, so that's my talk. That's my story. I'm sticking to it. Are there any questions? Well, I appreciate the time and I appreciate the opportunity to talk to you all. Have a nice day.